Until 1995, California required a blood test for sexually transmitted diseases, or STDs, before getting a marriage license. But recently, young adults and gay men are being infected at a higher rate than expected. Here with further details are Dr. Winston Tillman, STD controller for San Diego's County Health and Human Services, and Dr. Sheldon Morris, infectious disease researcher with UCSD School of Medicine. Welcome to Evening Edition.
Thank you.
Dr. Tillman, how does the county track sexually transmitted diseases?
When a medical provider in the community diagnoses a sexually transmitted disease, specifically gonorrhea, chlamydia, or syphilis, they send a written report to the county. It's called a confidential morbidity report. We also get reports from the laboratories where the diagnostic tests are run as well, so we get two different reports.
Okay, well, let's take a look at the actual numbers on how the county compares to the rest of the nation based on a new report of 2012 cases from the Centers of Disease Control. Gonorrhea cases in the county were up from the previous study by 19% versus about 4.1 nationally. Syphilis in the county was up 12% compared to the nation's 11%, while chlamydia rates in the county rose to 6% instead of the national increase of just under 1%. Let's continue on this. Could this increase in numbers, Dr. Tillman, be because we actually have better screening these days, or do you think there's an actual increase in the numbers?
Well, I think that it's likely that both of these are true. Testing for gonorrhea and chlamydia has become much simpler and less invasive for most patients in the last several years. And we are being more aggressive about screening for gonorrhea and chlamydia at sites other than the genital area, which is where most of the testing was done previously, including screening for in the throat and in the rectal area, depending on the types of sexual acts that people are engaged in.
I see. It could be a little bit of both. Now,
right.
Dr. Morris, the CDC also reports that about a third of the San Diego gonorrhea cases were in men ages 20 to 29. Mm-hmm. Why are these men more at risk?
Well, obviously these are people that are having unprotected sex. With gonorrhea in particular, this is what, like Dr. Tillman says, is where we are finding it at other sites. It likes the throat, it likes the rectum. So, and that is also among men who have sex with men who are in this age group who are having sex with other men who, with different kinds of sex that would lead to the gonorrhea infection at different sites.
Well, who should get tested for STDs? Everybody? And how is this test done?
Well, the main targeted group for things like chlamydia would be young women under the age of 25 that are sexually active. For other STDs, it's based on people's risk. So if people are having new sexual partnerships, then they should talk to their provider about getting tested, and then the provider can decide which test should be run for that particular person and where.
And talking about testing, Dr. Tillman, how is gonorrhea, syphilis, and chlamydia treated? How are they tested? How is it treated? And are they curable?
Okay. All three of these infections are bacterial, so they're all curable. Gonorrhea is treated now with a combination of an injectable antibiotic and one of two oral antibiotics. Chlamydia is treated still with oral antibiotics, and syphilis is treated with injectable penicillin in patients who can receive penicillin.
Okay, and how about the test, Dr. Morris? Is it a swab test? Is it a blood test? How are these tested?
For gonorrhea, and chlamydia, you can do a urine test for testing for urethral or cervical types of STDs. But for the rectal and throat sites, you need a swab. Syphilis still needs a blood test. But it can be easily done.
Pretty simple testing. Moving forward, I'm going to ask both of you this, but I'll start with you, Dr. Tillman. What needs to be done here in San Diego County to reduce this high rate compared to the rest of the country?
Well, I think we need to encourage open communication between medical providers and their patients, and also between patients and their partners regarding STDs. I think the more people talk about these issues and pay attention to their sexual health, the more headway that we'll make in terms of reducing our rates. And also, I think increasing awareness of the resources in the community where people can receive testing and education regarding these STDs is also important.
Okay, how about you, Dr. Morris? What do you think could be done to help reduce the rates?
I think that the main is to continue funding public STD clinics, community providers that reach out to special populations such as gay men, and just awareness, as Dr. Tillman noted, for especially young women and young people who are sexually active to be seeking a provider for HIV and STD screening both.
Okay, well, we have a lot more on our website, kpbs.org. Dr. Morris, Dr. Tillman, thanks so much.
Thank you.
Thank you.